and welcome, Dr. Fan in the house. As always, this is our first live of 2025. Is that right? Yeah.
I don't know, maybe. Was it January? No, I don't remember when we did last.
It's like end of Feb. Here we are. It's a new world. It's the world of maybe there's a bird flu pandemic coming, right? And it's the world of certain things flying in the air and
Seven planets are aligned in the last time it happened 300 years ago. So
right. This is the thing. It's a different world than we were in even a few months ago, which is really kind of crazy. So I just wanted to. I think we need to have a conversation, and it's so good that you're here and able to chat with us about really what is going on. What do we expect this year? How can we prepare? What we need to be aware of? What are you seeing in your practice? When it comes to flus and things like that. Lots of coughs that are happening. People are struggling with the amount of mucus in their coughs. And I wanted to just, have a conversation about some of these big ticket, big topic items that people often struggle with and they don't know what to do with, or they're hearing things in the news and they're not quite sure where it should go. Yeah, so I'd love to, I think, kick off our conversation. I'm going to do a quick little video for Instagram. Hey guys, we're live on YouTube. Come join us, MD with Spirit, right here. And we are talking all things to do with current news about health. That includes bird flu and a whole bunch of other stuff. So come find us. Oh, wait, that didn't record. That's not helpful. I'm going to do that again. Hi, everyone on Instagram. Come join us live on YouTube with Dr. Fan. We are discussing current health issues, including the bird flu. So, Dr. Fan, say hi to everyone on Instagram.
hello.
Join us. All right. So, hopefully more and more people will join. We've got some people joining here. If you're in the chat and you've just joined us, come and say hello in the chat box. Tell us where in the world you're coming in from. And so do you think that we should talk about this topic? It's a big one, right? It's a big topic and an important topic to talk about. Michelle Nicely's here. Hi, Michelle. Patty Millette, thank you for your time and sharing today. Rafi, Dorian, nice to see you here. She says it's crazy, the planets, and it's also my birthday. Well, your birthday is coinciding with the start of the Mercury in retrograde shadow and so much, what were you saying, Dr. Fan? Geomagnetic stuff going on?
Yeah, crap. Poo, whatever going on.
Can you talk more about that a little bit? Because last night, I had a really restless night. So I wear an Oura ring. And I woke up this morning and I opened my app and my Oura ring says, "Why did you have a restless night?" And I checked and I had a lot of movement last night.
I am no expert on this. I just know that there's in the news, it's been saying like there's a 7-planet alignment. We had a recent one actually too,
Yeah.
another interplanetary alignment, not even a month maybe. There's a 7-planet alignment tonight. Well, you can see by the naked eye, which from what I understand hasn't happened in like 300 years. So there must be some big significance of that. And many of our sensitive individuals are feeling that, and sleep will be disrupted, unfortunately, because of this activity.
Yeah.
And also, as I understand, there's some Schumann resonances that are all off the chart, and it's just I don't know how to go into that. Just be aware, just be aware that it's not you because you're going crazy. There's something else affecting you.
Yeah, there's something else affecting us. So Christina says it's saying, could you please talk about healing lungs when exposed to ash in LA? I spend about 6 hours a week outdoors.
Yeah, I mean, if you listen to his podcast, Anthony Williams Medical Means podcast about protecting your lungs, I mean, do those things he talks about. If you have to use the wet kind of cough, but also consider bringing some glutathione, NAC, bring in some tinctures that for respiratory OSHA, rhumation, mullein, these things for your lungs as well. Do the best to stay out of the air that's contaminated, basically, the best you can. If they wear a mask if you have to do that, even just to kind of filter some of the particulate matter that may be in the air from plastics and metals and whatever that's been burned.
Yeah, so I mean, I think it matters to really know what to do. I think wearing a mask, especially and I know a lot of people say, well, most masks don't work. But, there are professionals who use masks for, when they're painting, or um, when they're using dangerous chemicals, airborne chemicals, who wear a mask to protect themselves. So if you're really exposed, you might consider getting a mask like that. Also, how to heal the lungs. Let's talk about that for a moment. So I don't know if you, Christine, if you've seen my white lung blog. And I know when it talks about white lung is specific when you have a lot of scar tissue and stuff showing up in the lungs. And when they do an x-ray, they see white in the lungs. That's why it's called white lung. But in there is a ton of support for healing the lungs. And it doesn't matter that it's talking about white lung, even the exposure to ash, we will cover in there. So, you spend 6 hours a week outdoors. It's important to take care of your lungs by making sure that you have some. So I like to create a microclimate inside a mask if I'm wearing it, right? So one of the ways to do that is to use. I love the Living Libations product, Longevity. It used to be called Longevity for lungs, and then they changed it to Longevity, and it's the same formula, but it's so helpful for opening up the bronchial tubes and the trachea, and for having some ease with your breathing. So I hope that helps. So Yvonne D asks, I'm gaining my nail moons back on my thumbs, but my other nails at times seem the moons. I take 2 droppers of zinc daily. What would you say to her, Dr. Payan?
It will take time, and you can even go higher if you can tolerate it based on your vagus nerve. I take a bunch of that stuff. I take like 3 dropfuls twice a day at least, in addition to an oral capsule. So I'm using my zinc up a lot. So you might have to take more, and you have to give a little more time for it to go. Because most people do have their little moons. You don't see this one. Their moons on their nails, right? Can you see that? Ah, little moon there.
Yeah.
It does take time to get some moons on your nails here, and especially if you're burning the candle both ends or 5 ends, like Anthony is doing, they can go away really quick.
Yeah, that's a good tip. So my daughter had whites on her nails when she was younger, and it would like bug her. So she kept asking me, she said, Mom, how do I get the whites off my nails? And I said, take more zinc. So I upped her daily zinc. You're taking 2 drops a day. You might want to do a little bit more, 3, could be 4. It depends on, if you look at the medical medium protocols in all the books, including the Brain Saver book, Cleanse to Heal book, the original medical medium book, or the revised and expanded medical medium book, often the recommendation for zinc most of the time is 2 droppers twice a day. So you might want to do that, right? So, all right. So Dr. Pan, let's talk about bird flu. Now we know what, I'm sure all of you who are listening have questions about it, have thoughts about bird flu, what is going on with bird flu? What do we need to do? How can we really do more than, I think the directive that Anthony has given us in the podcast on bird flu is really to stop eating chicken, right? So I don't know how many of you all watching, how many of you eat chicken? I know probably most of you are not eating eggs, but if you're eating eggs, maybe once in a while in a baked good or something like that, what are we talking about here? What did you interpret from what he shared with us?
So basically, if you listen to podcasts, he says it's more likely that this is going to occur unless something intervenes, the angels or God intervenes and kind of goes a different route. But it's going that way now. We are in fact seeing a lot of flu in my clinic. My clinic, I think, kind of runs behind a little bit from the trends from both coasts, kind of in the middle. So, but we're seeing a lot of flu, and Texas has seen a lot of flu. And this is the time where it's gearing up, setting the stage for bird flu to be more problematic. When he said that again, jump in if I'm wrong. When the bird flu meets the influenza, the flu basically, they kind of duke it out, and they decide that they don't want to die and kill each other, so they kind of like mutate or meld basically, and they one takes
Sequence.
the
Yeah.
takes, I guess, the characteristic of another. So it may gain this function of being able to jump from uh, human to human after that. And you've had a few cases in the news about, the bird flu being affecting people and stuff like this. So if this continues, we're going to see more and more people getting bird flu, but we won't know because there's not a really good way to test for bird flu. There's not like kits that are available. So you got bird flu. We're seeing some flu-like symptoms now that are testing negative for the C and the influenza A and B. And so you have to wonder, what is that? Is it just another novel virus, or is it actual something like that? And I don't know. I can't tell you. Protect yourself, wear a mask, get your zinc stores up, as we just talked about. Do the protocols that he has. He's got handouts on viruses and cold and flu toolkit. Bring in the herbs and supplements for the lungs specifically if you have to. And you have the shock therapies as well.
So, yeah, I love all that detail that you shared. Why, if you can illuminate for people, we know that the goal is for the bird flu bug and the flu bugs to kind of sequence together and create something else that it could be harmful to humans. But why no chicken?
Okay, so basically that the bird flu, it thrives on avian protein or poultry or whatever it is, right? So if you know what it does to these animals quickly, and it kills them pretty quickly, is what we understand, then you'll know that it'll draw from the protein that you've taken into your body and use that. It doesn't like you don't eat chicken and it poops it all out. The proteins get incorporated, and that way that virus can incorporate that protein that you have and use it against you basically. And so you don't want that. You want to reduce that risk of that.
So he also said, I think people think that they eat something today and then it's out of them tomorrow,
Yes,
right?
yes.
And that's not the case. It doesn't work like
No, these proteins linger and stuff like this. So, but even though you have had a bowel movement or something, the proteins stay around. That even goes for collagen. If your source of collagen is chicken, it's a nice, it'd be a fuel source for that virus. In the old days, there's a Nature article in 2009, basically, and talking about how doctor biologists, microbiologists would grow these viruses on eggs because eggs has a nascent or very young pliable protein that these viruses can use for fuel easily. So doctors in the old days used to say, if you've got an egg allergy, don't get the flu shot because it may interact somehow. That's what they used to say. Now
really to say that if you have an egg allergy, don't get the flu shot.
that was what they used to say. Nowadays, the technology to make these vaccines are different, so they don't use the egg thing as much. But that still holds because the virus will take hold of that egg protein and utilize it for its own. We think eggs are protein, protein, protein. I mean, in reality, they're the chicken periods. But the thing is, it can take that protein and use it for its own source replication and whatever.
So just to reiterate for people who are watching, there's a lot here that we have to keep in mind. So one is that if you think you ate chicken last week and that you're free of chicken, he is saying that we have a lot of proteins get stuck to our livers, our spleens, our kidneys, our brains, and they last in our bodies a long time. And he said that, so you're saying that the bird flu bug will attack those proteins in our bodies because it's designed to kill birds and bird flesh.
Yeah, that's basically what I kind of understand, basically, and it does apply for turkey or duck or any other type of poultry or wing, fowl, let's say, right?
Yeah, so somebody is asking, I'll put this question on the screen. Does this apply to turkey and duck?
Yeah, duck, turkey, pheasant, whatever.
Quail, turkey,
Uh,
duck, pheasant, um, chicken, all birds, because
partridge.
the bird flu is not differentiating between birds. If any bird is affected, it could be geese, it could be sparrows, robins, all birds are
Mhm.
affected, not just birds we eat, right?
Right.
Right. So then next question is someone saying, well, how long does chicken protein stay in the body?
I think it's variable. It's hard to say how fast is your body process. How good is your liver? How good is all these other things in your body? I think maybe 90 days would be a safe kind of average to say, but I think everybody's different. It's hard to really say. And how do you prove that? You don't run a radio tracer in somebody's body with chicken. Eating Chick-fil-A and then goes throughout the body. Nobody does that. So, but I think 90 days would be something to look at.
Yeah, I think that he says in so I just want to point out to people in liver rescue, Anthony talks about how it takes 10 to 15 days for troublemakers to process out of the liver. But then in Cleanse to Heal, he says over 90 days can be taken to get these proteins out of the body. Is everybody following that? Yeah. So somebody else asks, does cleansing remove the chicken proteins out faster? I
Yeah,
imagine,
I would think so.
yeah, I would imagine that it would. And then there's a question about pets and people feeding their pets. He did mention something about pets in the podcast, didn't
Yeah, I
he?
did. Can't remember the specifics, but
I think he said that it's okay to feed them a little bit of it, but you want to find different sources if you can. He didn't say don't feed your pets turkey and chicken, but he didn't say yeah, it's totally fine to do it either. I don't think he said yeah, you could do a little bit, and I feel like when he does that, he's kind of like yeah, you could do a little bit. That's kind of like saying it's preferable not to, but if you have to, then you could do that. But you know if you can feed them something else, like other type of meat, could be beef or lamb, I don't know. I'm not a pet person. Are you a pet person, Dr. Fan?
sorry.
Not a pet person, yeah. Um, so somebody else commented and they said that AW did say pets eating poultry could do it for now. That's the thing. There was a little bit of a like a caveat with it.
I mean, if you're starving, you have no source of food. I mean, he'll say eat it, right? But better not to be, just in case it takes off and you're screwed. Hopefully you don't have any problems at all.
Absolutely. Absolutely. This is exactly what you're saying. So he also did say, so how long should people stay off fowl?
I think he said the whole year, right?
He did. He said a year.
Yeah, yeah.
Yeah, it's about a year, you guys. So, let's just keep in mind that that's what we're here to do. That's how we stop the spread in a way. That's how we contain it. That's how we prevent it from you know, becoming more of a human flu. And God and the angels are going to intervene, and hopefully it won't turn into that. But we just wanted
Yeah.
to talk about it a little bit more because I know I've been getting questions. I'm not sure if you have, Dr. Fan. Have you?
Just everybody pray and hope
Yeah.
the higher power intervenes because we don't really want to go through that. Obviously, if we can get away from it.
Yeah, for sure. Um, Alison McLaughlin said something interesting. She said there are some veterinarians now telling people, if possible, to avoid chicken, turkey, etc. And there have been cases of dogs dying from bird flu already. Allison, thank you. That is very helpful to know.
Also, if you got a link somewhere, let me know. Let us
Yeah,
know.
if you have a link, can you send it to us, Allison? I'd love to share that with people who are asking me these questions. And I'm sure, Dr. Fan, I'm sure people are going to ask you as well. So Falaki Idawu says, what about guinea fowl?
I would think any fowl, any.
Any fowl, yeah.
Yeah. Even bats, I would probably not eat bats. It's just yeah.
Monica says, do these restrictions include the whole world? I would say so.
Yeah.
Yeah,
That makes sense.
whole world. Yeah, for sure. So, all right. We had some other questions coming up. Let's take some of those. And we have this question. My sister is having a flare up with her rheumatoid arthritis. What shock therapy would help with that? Already doing all the vitamins and mineral and lemon water, celery juice, heavy metal detox, smoothie, etc.
What kind of shock therapy? Wonder if propolis might be something to consider. It depends on what your symptoms are. Really, kind of you can move. If it's just joint pain, You can do California poppy for pain, but propolis would kind of cover some of these things. I don't know, Anita, what else would you?
Yeah, I would say if you had to do shock therapy and she's having a flare, lemon balm shock, California poppy shock together, because if you're attacking the pain that shows up in the human body, those two together is very powerful. And if you do a shock therapy, I think the shock therapy for lemon balm and both cal poppy are 4 droppers every 3 hours. So you could just do that every 3 hours. And it's super helpful. And the other thing that is helpful to know is, yeah, I mean, even look, at the end of the day, when you have a flare, it's a viral flare. So always with zinc, micro C are helpful. And I agree with Dr. Fan Propolis, extremely helpful. And you can increase also a little lysine. Curcumin is very helpful for pain. I know often for shingles pain, Anthony recommends cold packs, but for rheumatoid arthritis pain, some warmth is helpful, like some heat packs. It can help soothe the muscles and soothe the joints a little bit. I also there's a difference between dry heat and wet heat. And I just wanted to point out, like, dry heat is just a heating pad or something, but moist heat is like a hot water bottle. And there's a different quality of healing that you get, or comfort that you get, from moist heat. And there's also heating pads by Sunbeam. Go to sunbeam.com, and they make heating pads that have like a sponge which you wet and you put inside of it, and you get the moist heat from that too. So I think that was helpful. My dad, when he had RA really badly, the warmth would really help him. So I hope that helps your sister. Falaki says, I'm having a sharp pain in my sides just below my rib cage. It's worse on the right. What might this be? Dr. Fan, what do you think?
On the right, can you hear me?
Yeah, I can hear you.
On the right side, where's this? So again, you need to talk to your doctor. Where's the question here on the right? On the
It's
right.
right on the screen. Can you not see it?
Oh, okay, I see it below my rib cage. So you always, again, you need to be evaluated by a doctor, not me online. I'm not a doctor online. Okay. The thing is, you think of right side of pain, you think about gallbladder. If there's no trauma, okay, you think about trauma. Did you fracture? Did you hurt a rib or something like this? Aside from that, you think about gallbladder, right? It can also be gas. Gas can take you to the emergency room and really be painful. And they do a whole workup and find anything. So it could be that. But again, you need more specifics. You need examination. Are you pooping regularly? All these different things come into play. If you have a rash, you have shingles. I mean, that's the other question, right? I've had cases where people were brought in the hospital and we thought it was a gallbladder, but in actually a day or two later, waiting for a surgery to happen, her rash came up and it was shingles. So there's different things.
Yeah, for sure. Okay, so our next question. I mean, I second that advice. You got to go to the doctor, go get it checked. In your sides, so you're saying both sides it's happening, right? So very likely it's viral, but you wanna go get it checked for sure. Our next question is from Colleen, and she says, MM's protocol for bipolar includes Adapto B complex, and Vimergy's bottle says do not take it if you have bipolar.
I think they are bound legally to write these claimers, like these California proposition things. You would speak to your practitioner about it, like, hey, can I do this safely or not? I mean, you're talking to psychiatrists who write prescription medications at the highest dose, and oftentimes they take two medications at once, and there are label warnings saying don't, SSRIs in excess can cause serotonin syndrome, all these different things. So even with the medications for bipolar, depression, anxiety, they can interact themselves, and these psychiatric professionals are always writing maximum doses and combining these two. So you have to do it under the direction of some health provider that would tell you. But for the most part, I think I would be comfortable telling my patient, if they didn't have any other problems going on, trying it. And if you feel bad because you can't methylate very well, then maybe you don't do it.
Yeah, it is right what Dr. Fan's saying, that Vimergy as a supplement company is bound by the law and what the FDA says about what it has to print on their labels. So use your intuition, use your common sense, talk with your doctor, and then you can take it from there. My personal take is that if medical medium's recommending it, most likely I would do it for me. But everybody else has to check with themselves to see if that makes sense for them. Um, so our next question is from Marilee. She says, if we have a lot of mucus that is yellow in color that comes out of our nose or into the ears, it has really resurfaced over the winter months, then what specifically can we take as far as herbal supplements or foods to combat it?
I would definitely go back to what we just said a minute ago about air quality and using remedy and stuff. You can use those remedies easily. To my, coming to mind right off the bat is mullein and osha, things like defamation. If you haven't done golden seal already, which I'm assuming you have if you're following medical medium information. So those are some things, but also again, the NAC can help make sure bring it up. If you're hydrating yourself well, maybe with fruit juices that are fresh, you need to hydrate well so that thick mucus can come out and can get expectorated basically. So try that. If you want to put an onion in hot water and put your head over it with a towel, it helps bring up these mucus and stuff like this. So consider those things. Strep seems to be an issue perhaps that's going on.
Yeah, strep could be a strep flare that you're having. Um, and if you have yellow mucus coming out, that means that the mucus has pus in it. So if you have pus in the mucus, that means that there's some pathogen creating that. It could be viral, it could be bacterial. I think people like to have theories about whether it's yellow or green and what it is. And sorry to go into so much depth about snot, but I think it's a relevant conversation right now because so many people are struggling with mucus and coughs and what have you. So I would say, what herbal supplements I mentioned, the White Lung blog. I actually sent that out on I sent it out earlier on our newsletter today. If you got that newsletter, check out. It's got the link to the latest ones in there. So check that out. But what you can take, it's all outlined in there. And I have a lot coming up about reducing mucus in the body. There's a lot of information and on Instagram that we'll be posting very soon about reducing mucus and keeping your mucus levels low. And the biggest thing is reducing fat, which I know, Marilee, you don't eat a lot of fat, so your diet is controlled that way. But remember, there's a lot of old matter and thick fluids. I mean, what would you say, like, Dr. Van, you take people's blood all the time, right? So do you see thick blood when you draw blood from people? And
Yeah, you see dark blood, you see fat. I've had some posts on my Instagram and YouTube about like you let it sit for a while and it gets kind of cool, and then basically it looks like a milk that comes out of it. That's a lot of fat, and that's just your blood is swimming in fat. Um, so that's definitely thick blood, and so we see that.
yeah, it's definitely thick blood. Definitely, also not just thick blood, but also your fluids can become thick, like your lymphatic system fluid can become thick. Then your other fluids, like mucus, is sort of a fluid, right? And if that becomes thick, it becomes really difficult to get out of the body. So mucus needs to be thin to leave the body. So if it's coming out of your sinuses, your nose, eyes, cough, if it's thick, it's not going to leave. So that's an important note there. All right. A very interesting question. This is affecting you in Texas, Dr. Fan. Are you seeing cases of measles?
I'm not. I don't see kids, so I can't. I don't really see that.
Okay.
Um, so I mean, what we do for kids that are not vaccinated, you have to make the decision. Remember, keeping in context that measles has been around for many, many years. If it was a very, very severe killer of people, your grandparents and parents would not be around, right? In the old days, people did have measles parties, and some I'm sure they still do. Um, Even in those who are highly vaccinated populations, like there was a story about these military cadets or I think naval office, Navy, uh, enlist, Navy folks basically. They're on a submarine, and they could not dock and land the ship because the whole mumps was going around for months and months and months amongst the most vaccinated population, which is a soldiers who cannot avoid getting vaccinated. So these are some things to consider. If you're fearful, talk to your doctor about getting the shot for your child. But again, it's been around for many years, and I think there are some studies to suggest that those who get measles, the real measles, obviously, later on they may have less reduced risk for cancers and stuff like this. But again, if I tell you, oh, don't do it, and then you get it, you're gonna like, oh, they're gonna tell me he's one of these crazy conspiracy theorists and stuff like this. But again, you have to weigh the risk benefits of doing that.
And also, I mean, you know, your name is Belay Nilat. Belayan Nilat. I'm not sure what your name is, but I will say I tried to pronounce it as best as I could. So you're saying that, what to do in the population that's not received that sort of treatment. Um, I think it applies to anybody. High vitamin C, vitamin A. Um, I know that a lot of vitamin A's today are found in um, fat based formulas because people believe that vitamin A is fat soluble. But vitamin A is found in a lot of foods too. So I have a blog coming out about this very soon. So look out for that. And I will post it to my Instagram and to, all places where we post our blogs to be talking about this outbreak because it's come up. You're like only the 25th person who's asked me about um, measles in children. So we're going to be addressing it. It takes us time to write stuff out. We want to present you the right information, but it takes a minute to like get it all out there.
It
But
also takes time for a vaccine to take effect. So if you get exposed and you think you're gonna get a shot today, it's not gonna protect you against your exposure already. It takes time for your immune system, if you have a good immune system even, and there are people who have been vaccinated who don't have antibodies. They don't develop the antibodies, so they get re-vaccinated. And it may 2 or 3 times before they actually get enough antibodies to show that they have immunity. And whether that's lasting immunity for years or not, it's a whole nother topic.
yeah, it's a whole other topic, which, at some point we could talk about. Dr. Fan has a lot of medical, data and things that he could share about that. But what I would suggest is you treat it like any other viral condition. You do the zinc shock therapy, you do vitamin C shock therapy, you do golden seal shock therapy, and propolis shock therapy. Those are the four most important ones. And then you can bring in some of the total immune blend formula by Vimergy, like that has the thyme and the mullein in it. That can be helpful. Topically, you want to apply calendula on it. That's really helpful. Elderflower tea is very helpful for this condition, as is burdock root tincture or tea. So if you're worried about this particular condition right here, and you're in a state like in Texas where this is kind of happening, I'm pointing to the screen, so just read that. If you see that happening, or if you're exposed to that, if you're a child and you're worried about it, you have to go with the shock therapies. Keep your child's diet as clean as possible, reduce the number of troublemakers, but also know that this is not the worst. This is not the worst bug. I'm not saying don't. I'm not saying to ignore it. Pay attention to it. Definitely deal with it. But I don't think it's a cause for great worry. What do you say, Dr. Fan?
Yeah, I think in the whole history of things to be worried about, it's not that one. And, I mean, there are cases where children malnourished or they have other immune issues, and you don't know. You don't know what the story is because this child who recently passed away, we don't know her or his medical background either.
Yeah. So I just want to point out Karen Churchill says vitamin A, D, E, and K are fat soluble, but actually, if you read Brain Saver, Karen, Anthony dispels that myth. There's a whole look in the chapter, what your brain is made of, and there's a whole section on dispelling the myth that these vitamins are considered fat soluble. That's a complete, I mean, he explains how they got there. He explains why logically it would make sense that they got there, and then he breaks it down and tells you why it's not true. So do check that out. I know it's a very commonly, and with this particular pathogen that we're talking about, people tend to think that, oh yeah, it's I should go get the vitamin A fat soluble stuff. Like, no, you don't need that. You don't need that. Um, so uh, Elizabeth, just go and listen to the live again. Sorry, we have so many more questions to answer right now, but it's all there, so you should be able to do it. Rafi says, my son had both the treatments as a child, and he still caught measles at the age of 14. Yeah, it's not a guarantee to prevent anything, as we've seen in recent pandemics too. So another question we have is, what is the best treatment for seasonal allergies?
So the best treatment is going to be really hitting strep a lot, right? And doing the herbal stuff that we talked about again, golden seal, lamatium, mullein leaf. These are very good.
Hi.
Obviously avoiding some of the things that exacerbate it. If you have a dog or cat allergy, if you can avoid it, great. If you can't, then you have to live with it, right? If you've got a HEPA filter, you've got these filters to help take some of that load down because you can't avoid the trees, you can't avoid these things, right? But at the root of that is what's deeper than that. There's some pathogens in your body that you want to work on in your immune system. So get off of the troublemaker foods that probably worsen them. I had a guy, the worst case of sleep apnea in 20 years that the pulmonologist had seen, could not use a CPAP, had to use a BiPAP, and even that wasn't working. Got off eggs and dairy. He comes to my office every time. Dr. Brand, I can breathe again. He's sticking his finger over his nose. I'm like, okay, thanks, man. Don't do that. Don't touch my doorknobs. Don't, wash your hands. But he's just like, this is the best in the world. I'm like, okay, good. Yeah, keep on going. Then every now and then he's like, go eat barbecue every now and then, and just screws me up. Totally, I'm like, well, stop eating barbecue, man. I'm sorry, but it really, it really helps. You have to give it a long-term thing. You got to get the stuff out of your body.
I totally get that. That's so good to know, though. Yes. So, like Dr. Pan said, for seasonal allergies, vitamin C is the bomb. Like, it just clears them up. I've had a lot of allergies in my life, and every time I've taken high dose vitamin C, clears, clears, clears. It just goes away. So, vitamin C is important. Like Dr. Pan said, strep herbs, lamatium, eyebright, mullein, thyme, lemon balm, cat's claw. They're all strep herbs. They're really important. And then you could also oil of oregano. Don't forget about that one. And then curcumin, and then a little reishi can be helpful too. All right. So this is an interesting one. We haven't had this question in a while. What are the remedies for impetigo?
Impetigo has been linked to streptococcus, right?
Mhm.
But you want to use the anti-pathogen, antibacterial type regimens. Again, it's just the thing we just talked about. Again, you can do golden seal and all that stuff. Obviously wash things because sometimes bacteria can get on other things. But yeah, get your immune system good too, because if your immune system is weak, you can throw out stuff at it and you won't have as good results. So getting enough sleep, getting enough zinc, getting enough vitamin C, all these different things that help boost your immune system is what I would recommend.
Yeah, those are all the most important recommendations. I completely second that as well. Impetigo is an interesting one because I think that Anthony has obviously not directly talked about it. I think it's mentioned in some blogs and stuff like that. But but yeah, I think you're right. There's definitely a relationship to strep, but I thought also that there was a relationship to viral too. That it could be a combination of both. Sometimes it's all strep, but sometimes it can be a viral piece, and I believe it's herpes virus that is unlisted by the medical community. But it's not staph infection, it's not a staph bug, but it's a viral, herpetic viral, often combined with strep together. So it shows up that way. Um, you know, so I hope that helps. And
Think about some propolis topically too.
yeah,
That
yeah,
would be helpful.
absolutely, propolis topically would be excellent. Um, We're getting some really unusual ones today. So before you go, I know you have to go soon, Dr. Fan.
Mhm.
So she says how to deal with sickle cell anemia.
Oh yeah, that's going to take a long protocol to do. You have to go deep, and it's going to be probably the root of it viral. Any of these blood disorders that Anthony's talking about, again, this is medical mean perspective, it's going to be viral. And so you got to really hit the viruses hard and get your immune system revved up. Again, doing all this, avoiding troublemaker foods. Actually, you also have to be careful about stress too, because slightest bit of stress will throw you into a sickle cell crisis. You know, if you're not hydrating well, if you're not eating well, if you're not sleeping well, these things tend to throw people off. So a lot of stuff, anything that helps the blood out, including the antivirals. You know.
Yeah. Um, yeah, I think that with the blood stuff, you have to be able to go deeper. And what it means is that you have to commit to the protocols by doing, sticking to the morning cleanse and doing more cleansing. I think with sickle cell, we have a lot of heavy metals involved.
Yeah, yeah.
There's a lot of viral stuff involved, but it's not just one virus, it's multiples. And then inherent vulnerabilities that can create that different shape of the red blood cell, which is what, for those of you who don't know what sickle cell is, it's Dr. Fan, why don't you tell people what it is?
Well, basically, they say it's genetic, but we know from immune perspective it's different than that, right? But basically, the red blood cells sickle. They kind of change shape and they can't carry the oxygen as well. And in crisis states, you'll get thrown off into it, and these they can get stuck in the blood vessels and stuff. So you have to hydrate, so that you can get the blood moving and distribute the oxygen because the blood cells carry the oxygen. And so it's very, very painful
Yeah.
for people who get sickle cell crises, and they have to go in, usually hospitals, get hydrated and pain medication to kind of knock things down. But it's kind of almost like a vicious cycle. I mean, once you get flared down, you kind of go down the path, and you got to stop it if you can. Unfortunately, the majority of sickle cell anemia patients will tend to end up on pain medications and narcotics and stuff just to kind of get out of that loop. But it's very addictive, and those medications, from a medical meaning perspective, can actually feed things. So it's like you do things to get out of the crisis, but then in the long term wise, you have to go really, as I said, really deep.
Yeah, I lived in Oman, Dr. Fan, and the percentage of people in that population who have sickle cell is very high.
Mm.
It's huge. I think it's one of the highest populations in the world that has high levels of sickle cell. So, with sickle cell, the way to improve that, um, is to really have to work on cleansing. Cleansing's a really big deal. And that's why I said deeper, because cleansing really does take you deeper. And I would recommend doing the heavy metal cleanses along with the extractor smoothies. And I would recommend doing, um, you know, getting on board with the antivirals, because that can be really helpful in staving off. In one of my clients, it was helpful. She figured this out on her own, but she was like, when I take enough antivirals, I can stave off a crisis, which is very painful. So there's a lot you can do here. There's a lot that you can support yourself with. There's a lot that you can do with pushing back on sickle cell. I don't think that it's something that you're just given as a sentence and that you have to just live with it. I think you can get some really great improvements with this sort of disease. And maybe you don't get as good results in the first 6 months or first 9 months, maybe, but you need more than a year, maybe two. But after that time, you really, as you cleanse the body, you start to get better and better results with that. So I hope that you take that as positivity, optimistic, because I think that sickle cell patients often have a very negative outlook on their life because of their pain crises and the fact that they have to live with pain and have to end up on pain medication. So I hope that helps. It's a good question. All right, Dr. Fan, thank you for your time today. We discussed, I don't know, like amazing topics today. If you are just catching us, we talked about bird flu, we talked about measles, we talked about sickle cell, and we talked about impetigo. So these are some big topics we discussed today. I hope you'll go back and listen. We talked also about mucus and coughs. So I hope you'll go back and listen and catch us for the next one, because we will be doing these more regularly. And tell other people about this show. It's always on YouTube. Share the link so that other people can subscribe and join and get their notifications on so that when we do go live, you're here for these conversations. Thanks so much, Dr. Fan. I'll see you the next time. Bye, everybody.